Nobody loves getting shots, right? But let's dive into this explainer on why needle angles literally change everything. Have you ever wondered why some shots go straight in while others are totally tilted? Well, that specific angle dictates exactly which layer of tissue the needle actually hits. And guys, that tissue layer totally controls how fast your body absorbs the medication. Here's the golden rule. Steep angles mean fast absorption, while shallow angles give a slow, steady release. Okay, let's start by going deep with the intramuscular injection. 90 degrees, straight in. We call this the IM, or intramuscular injection. The needle goes in perfectly perpendicular to your skin, reaching right down into that deep muscle. Muscles are supervascular, meaning blood flows fast. This speeds up uptake for things like vaccines and antibiotics. But what if we need to slow things down? We have to find that just right middle ground. Enter the 45-degree angle. This is your classic subcutaneous or sub-Q injection. Here, the needle slides into the fatty layer sandwiched right between your skin and muscle. Why fat? Because it has less blood flow, giving you a much slower, sustained medication release. Next up, a shallow 15 to 30-degree angle is what we use for intravenous or IV injections. This super shallow approach lets the needle slip directly into a vein instead of hitting deep tissue. Talk about a VIP pass. This completely bypasses tissue absorption for immediate bloodstream access. Finally, the shallowest of them all, 10 to 15 degrees. We call this the intradermal injection. Sneaking right beneath the epidermis, this extremely shallow angle usually just leaves a tiny little bump. This precise surface-level placement is exactly what you see with things like TB or allergy tests. So, knowing these baseline angles is crucial. But honestly, patient anatomy can change the whole game. We always have to adjust the angle based heavily on a patient's amount of subcutaneous fat. For example, in an obese patient, a steeper 90-degree angle is actually used for a sub-Q injection. Ultimately, it's all about reaching the exact right layer to optimize absorption and minimize that pinch. So, next time you get a shot, are you going to know exactly which layer they're aiming for?
At CB Institute, where knowledge blooms, we prepare the future of nursing.